If you need a kidney transplant, you might wonder who in your life could potentially donate to you. Living donors don't need to be family members. They can be a spouse, friend, co-worker, or even a compassionate stranger. To donate, someone must be at least 18 years of age in good physical and mental health. They must come forward on their own without any pressure. Every donor is cared for by a completely separate medical team from the recipients, and this is to make sure that donor safety and well-being always comes first, and that they are making the decision freely with full understanding. You'll be surprised to know that not everyone who volunteers is able to donate. In fact, for every 5 people who step forward, only 1 is able to move ahead. During detailed medical testing, issues sometimes come up that make donation unsafe. There are a few situations where someone simply cannot be a donor. These are absolute contraindications. Donation isn't allowed for people with significant heart disease, stroke, or peripheral arterial disease, active cancer, infections, untreated psychiatric, or substance use conditions all make donation unsafe. History of melanoma, even if it was remote or treated many years ago, is also an absolute contraindication. Now, let's go through some of the common scenarios that patients and families often ask us about, like kidney stones, diabetes, obesity, and high blood pressure. So kidney stones don't automatically rule someone out. Someone may donate if they've had a stone on one side only or a remote history of stones, as long as their future stone risk is low. Higher recurrence risk, and therefore more caution, applies to people under age 40, those with abnormal metabolic stone testing, certain bowel diseases, or gastric bypass, or a recent stone episode within the last 3 years. Donors cannot have diabetes, but someone with impaired fasting glucose may still qualify if their glucose tolerance test is normal and they have no signs of metabolic syndrome, meaning normal cholesterol, no blood pressure, no obesity, and no albumin in the urine. Anyone with type 2 diabetes is not eligible to donate. Now, obesity is reviewed carefully. A BMI under 30 is acceptable. A BMI between 30 and 35 may also be fine if there are no other cardiovascular risk factors. If the BMI is over 35, weight loss is needed before evaluation begins. Now, for blood pressure, donors with normal readings are eligible. Some donors over 40 with well-controlled blood pressure on 1 or 2 medications may also be eligible if they have no end organ damage or no other cardiovascular risk factors. And now a quick word for young women considering donation. Donating a kidney does not affect your ability to get pregnant, and most women who become pregnant after donation have healthy pregnancies. However, there is a modest increase in risk of pregnancy-related high blood pressure, especially preeclampsia. Because of this, completing your family before donation is often preferred, but it's not required. Many women safely donate and later have healthy pregnancies with close monitoring. Even if someone isn't a similar blood group as yours, they can still help. If their blood group is different, it may still be possible to do a blood group incompatible transplant using special treatments, or they could take part in kidney paired exchange program. And this is a national program where mismatched donor-recipient pairs are swapped with others, helping multiple patients receive a kidney transplant. So if someone offers to donate, don't assume that they can't help. Let the transplant team do the evaluation. In the next module, we'll shift back to the deceased donors and talk about different types of deceased donor kidneys you might hear about. Terms like standard criteria, expanded criteria, and increased risk donors. It is important to understand these terms so you can make an informed choice if a kidney with certain labels is offered to you.